You have a patient who went to your clinic experiencing, let's say, 3-day history of cough with a history of fever with a Tmax of 38 degrees Celsius. The cough is noted to be productive with greenish phlegm and then able to expectorate, able to feed. Meron din siyang noted comorbidities pero controlled naman ang hypertension. So initially, your treatment would be treating the patient for community-acquired pneumonia. That's the usual culprit. Kapag gano'n naman, you treat the patient with antibiotics as well as mucolytics, and later on assess the patient. Let's say, for example, you want to be sure that since the patient has comorbidities of hypertension, you did a radiologic exam or x-ray. Okay, an x-ray of the chest noted that the patient has a consolidation at the right lower lobe. Now, you treated the patient for after 3 days, symptoms have already resolved. Okay, completing treatment of the antibiotics for 7 days would always be essential para ma-clear out din at ma-complete yung antibiotic therapy and avoid natin ang resistance. You advise the patient to follow up after 7 days. Pero ang question dito, kailangan mo bang i-repeat yung x-ray after 7 days? Well, let's go to the day 7 of the illness. So day 7 ng illness, wala na siyang symptoms. Wala nang cough, kung meron man, makatila lalamunan. There's no fever. Since day 3, nag-resolve na ang fever. Hindi na nagkaroon ng fever above 37.8. And the patient feels or as well as breathes normally right now, able to go back to work. As actually the day before the consultation of day 7, nakabalik na siya sa trabaho. So on the follow-up, patient is already essentially normal. Will you request for a repeat x-ray? Not necessarily, because in most guidelines, if the patient resolves, okay, and no symptoms at all, you don't need to repeat the x-ray. The possibility pa rin kasi na kapag pin-x-ray mo yung pasyente, okay, it might still present with consolidation of the concerned lobe. Why? Bakit magkakaroon ka pa ng consolidation kahit nag-normalize na yung pasyente, especially on the symptoms? Well, we have what we call a radiographic or radiologic lag. Okay, radiologic lag is usually the phenomenon wherein the patient experiences resolution of the symptoms, specifically cough and colds, as well as going back to a well adult. Okay, but if you check the x-ray, it will still present with features of consolidation, though not as pronounced as the initial one 7 days prior. Okay, so in that situation, that might cause certain alarm with the patient. Kung inisip niyang, ay, meron pang pneumonia, meron pa akong puti dun sa may x-ray ko, Dok, nakakabahala. Kailangan mo ba bang mag-start ulit ng antibiotic? No. Okay, unahan na kita. You feel better, you have a resolution of your symptoms, and you don't have any fever. And pinakamahalaga din pa rin dyan is the perception that the patient feels better.